Fluid knee joint, common sports injuries. Ronaldo has undergone knee replacement surgery. Someone is injured but the bone is not broken, the knee is swollen a little and the flat, painless, normal X-ray. However, when they go to the doctor, they are assigned to reconstruct the ligaments to cure knee, the factor that causes irreversible knee degradation. Fluid knees say easy to understand that the knee joint is loose. Depending on the life and activities of each individual, the patient will have different feelings of discomfort. Here are some of the most common manifestations of leg cramps. Feeling weak when walking. Difficulty with standing on the pillow with loose legs. The strength of the stone is significantly reduced, especially for football players. The shot is not as strong as before, the ball is not accurate, deflected. When running fast, it feels so easy to trip. When traveling on a flat road, it is easy to have a feeling of kneeling, losing the feeling of clinging to the road, reducing the ability to hold the foot to avoid falling when facing small obstacles on the road like stones, small holes, so people loose pillow easy to fall pillow when moving fast. Feeling abnormal when climbing downhill or stairs. Normal agility is no longer. Instead it is difficult to control his legs as desired. The most obvious manifestation is when the patient cannot walk or down every 2 steps as before. After a traumatic injury, the throat discovers muscular atrophy. This sign is common in people who are less physically active such as women, office workers, students. The knee joint is definitely thanks to the tight bony structure, which is covered by the articulation, the muscles in the front, the back and the ligaments on either side. In particular, there are 2 ligaments in the middle of the joint connecting the 2 ends of the bone that hold them together in the center of the joint. These 2 ligaments are called the frontal ligament and the posterior ligament. In that, the frontal ligaments are the most important role in helping the knee firmly. When the frontal ligaments are injured, the knee joints will loose. However, thanks to the thigh muscle offset during the first time after injury so the patient is not felt. Until the thigh muscle is shrunken, the thigh muscles weaken, and there is no longer enough tension for the first ligaments, signs of a new knee appear. In the past, people usually wait until the patient shows signs of liquid pillow surgery to reconstruct the ligaments. As a result, the knee replacement period lasted for more than 6 months. The current trend is early surgery, before the thigh muscles are contracted. This will improve postoperative knee function better. A few dozen years ago, when not much understood about the function of the ligaments in the knee joint, many orthopedic doctors have advocated for medical treatment for patients who break the ligament before. Now, they later noticed that the injury that broke the strings would surely lead to loose pillows. For professional athletes, loose knees reduce their level of play so much. They are difficult to perform movements such as running, jumping, pushing, kicking, balancing, turning, abrupt stop or touching the ground. Surgery will restore loose knee function and help many athletes return to the top. A typical example is a Brazilian football player Ronaldo, Brazil, who has had knee injury and has undergone a double ligament reconstruction in France. The first time before the 1998 World Championships in France. He came back to the surgery only 3 months, although doctors have advised not to. Finals against France and Brazil failed, and Ronaldo was hospitalized for surgery after the fracture was prematurely broken. With the experience, Ronaldo spent the next 2 years recovering and practicing under the guidance of orthopedic surgeons, and he competed successfully at Mondial 2002 in Korea. After surgery, people with 2 crutches touch the ground, feeling pain for 7-10 days. After that, it is possible to remove the crutches slowly. Usually after 2-3 weeks, patients can walk without crutches. Physical therapy sessions begin the 2nd day after surgery to help prevent complications such as ventricular atrophy, stiffness, help circulation better so surgeries scar faster. Patients will practice until they feel normal with normal movement. The average duration of this period is 3 months. The intensity and duration of the movement will increase until full restoration of the dance moves. This period also takes an average of 3 months. The third step is to increase your physical strength to get back to full fitness. At this time, the time is fast or slow depending on the will of the sick, usually 3-6 months. Thus, the athlete after the reconstruction of the ligament before the need for at least 9-12 months to be allowed to play again, according to health and life. The third step is to increase your physical strength to get back to full fitness. At this time, the time is fast or slow depending on the will of the sick, usually 3-6 months. Thus, the athlete after the reconstruction of the ligament before the need for at least 9-12 months to be allowed to play again, according to health and life. The third step is to increase your physical strength to get back to full fitness. At this time, the time is fast or slow depending on the will of the sick, usually 3-6 months. Thus, the athlete after the reconstruction of the ligament before the need for at least 9-12 months to be allowed to play again,